Hi, everyone. Good morning, and I'm really happy to be here. So as you heard, my name is Roberto Ascione. I'm actually Italian, traveling quite a bit. I'm the regional founder and current CEO of Healthware International, which is at 20 years old, which is crazy to say this year. Company always been dealing with innovation in healthcare through the lens of technology, creativity, and computer-human interactions. What I'll do today, I'll talk a little bit about our vision for the future of digital health, which you can imagine having started 20 years ago, where we were calling this computer science. We live like kids in candy stores these days. So, technology is very pervasive today. The ratio between humans and computers in the room, I believe, given we are at Upgrade the Life Festival, will be probably already 4-1, if not more. And this is really, as you heard multiple times already in the previous speeches, these all changes are coming from collaboration. It's no longer a solo play. It's really about how multiple stakeholders and people and different constituencies are really kind of working together to cause this change. This is already happening in other industries. We have seen music, of course, and transportation and travels really changed because of these technology archetypes, which made us, at the same time, consumers and producers of services and, more recently, goods. And this is really coming to healthcare, kind of really shaking the cards on the table that we have been used to for years. As I mentioned, a great driver is clearly technology, which is getting smaller and smaller. We touched already on wearables. We slightly touch on basically in-body devices, and we are certainly having the first ingestible devices that are starting to hit the market quite soon. This wealth of technology at hand is really allowing us to collect an incredible amount of data, which started with wellness and fitness, as we all know, but these are starting to really evolve into something way more meaningful, which we'll touch in a moment. Although health data are in many, many different places, even on Twitter, just in 2 weeks, if you geolocate the tweets talking about healthcare, you get a map of the location you're looking at to show the density of this information, which are kind of built into even simple conversations. And talking about conversation, we are really transitioning into a world where the interfaces will disappear, and we will have intelligent agents that, through conversational interfaces, will allow us to interact with artificial intelligence, which will give us hints into the behaviors change, as we just talked a few minutes ago, and probably into more kind of preventive medicine kind of down the road. Genetics has been mentioned too. The ability to screen ourselves at $800, soon becoming $600 each for the entire genome sequence, is really creating the hotbed for precision medicine and also for more individualized prevention programs down the road, with all the ethical and, of course, legal challenges that will come up, but this will be, eventually for the good. Something that's also changed in the last, particularly 3 years, has been the incredible boom of funding that has been hitting the digital health scene, and clearly this accelerated the ability not only to prove concepts, but also to start to scale up some of them. What this is all meaning? This is a radical transformation. This is not a marginal incremental change. This is not something that will slightly modify the way we conceive healthcare. This is something that will radically transform everything we know about healthcare, medicine, and the way we produce healthcare and we consume healthcare, probably we pay for healthcare. Of course, genetics is very important, but as WHO says, genetics is only one aspect of what influences our own health. Many other aspects are unrelated to genetic and biology, are actually about the behavior, are about the income, about the ability to search for the right solution at the right time. And all of this has a huge impact on our state of health and our outcome if you look in perspective. And the reason why I strongly believe since many years that digital health will be really a solution to many of the healthcare challenges is because technology has a unique and profound impact on all these factors. But for where this change is coming, this change is really coming from the amazing number of startups that are blossoming all over the world and really trying to change this with, of course, a high degree of failure, but also an incredible, traction in finding and exploring new ways. And we love at Healthware to really kind of map all of them and trying to see where, on the different angles, they are kind of tackling the healthcare issues. And we believe more and more into ecosystem approaches, as you heard in the panel right before, by multiple companies kind of really working together and cause a change. We like to map this, so if you go online to this address, you'll find a snapshot of our living database of startups from all over the world, and you can play with the body map and see who is touching which part of the body. Have a little bit fun with that. This kind of goes real time into our underlying database, which tracks that. We have been talking about data, so clearly the ability of tracking a lot of different data, not only from biology aspects, but all sort of other aspects through the open APIs from multiple sources, which we are not using yet in healthcare, will really inform us a lot about all the other factors that do really play a role in our healthcare from a behavioral perspective, but also from an actual care delivery perspective down the road. And as you have seen in the very last few months, all the wealth of data that we've been tracking for healthcare and for fitness purposes is really starting to evolve into predictive digital biomarkers. But basically, we are starting to extract from patterns of data which are, originally unrelated to healthcare issues, starting to make some guesses, some predictions about real conditions out of those streams of data. And this is something that will only increase as we will move forward more and more. Of course, we will need a place where this data will be kind of gathered and being actionable in terms of suggestions, in terms of any other actions we might need to take. And this is really coming very close to us. And every piece of technology that we have is starting to take its place. So probably smartphone will be more and more like the hubs of this kind of interaction between the data that we get on one side and the actions we can take on top of those. Like what we can do ourselves. There are a lot of things which we don't need to see a doctor, even if I was trained as a doctor, and of course I believe physicians have a great role and will always have a great role in healthcare, but probably to do some more meaningful stuff. So there are a lot of things that we can do ourselves and really get in front of a physician, which is a much more expensive interaction when we really need it and where we really need it. Of course, we can also take action. We are starting to see the first digital therapies around, which are basically kind of interventions which are software-based and fully clinically validated. The one shown is a Mycomed, which basically proves to reduce the blood pressure in 90 days of program through a meaningful behavioral modification or hypertension, which, as you know, is called the silent killer, being the #1 cause of complications and diseases in the cardiovascular at global level. On the side of this, consumer and healthcare professionals are starting also to join on platforms to really make digital health actionable. As I mentioned, physicians will probably change role, but probably technology will help them to become much more efficient, maybe upgraded physicians, as the title of the conference today. So this platform is really making healthcare professionals and consumers join forces with data in front and with actionable dashboards that both can play with and create much more meaningful interactions on board of a technology, and then meet in person, but in a way that is much more informed later on. All of this is creating what we are starting to see and think as a continuum of digital health. So if you look at this graph from left to right, we believe there is an area of signal gathering, so all the tracking that we are doing. Then this data and signals will get aggregated, and then this will be orchestrated to consumer portals that will allow access to this integrated data with interpretation to the end users on one side and to physicians on the other side. And then they will collectively, with a little dose of artificial intelligence in the middle, probably decide which kind of digital therapeutics and interventions will be basically taking place in the last segment of the continuum. Of course, this will take time. There will be a lot of integration that will have to be done. There will be a lot of open systems to allow the collaboration across multiple different platforms. So there's a long way to go, and probably is one of the reasons why we are all here today and engaging in this kind of thinking. So digital health is clearly very widespread as a range of interventions. We can start from a very simple, although very effective, information education-based nudges to really foster behavior modification, all the way up to digital therapy, basically intervention software-based that cause a positive, change, clinically validated. So where this is all going, we believe that this, as I mentioned in the beginning, will be a radical transformation on the very fundamental archetypes of healthcare. We have been really used to treat acute diseases, to really base our hypothesis and diagnosis on a few symptoms, looking at the history of the specific patient, and almost working in isolation. Well, all of this is more than likely changing faster than we think in a world where the prediction and working together in multiple stakeholders will be the norm, and we will be able to harness a lot more integrated view on our health rather than silos of different interventions that do not share anything each other. Of course, transforming radically healthcare, it's a much bigger endeavor than transforming travel. And there's a huge difference in this because there's nothing more personal than our own health. And this is really something that will trigger a lot more issues than just, something that can be transactional based and slightly fully technological. So in healthcare, everything that could be digital will certainly be, so there's no reason to guess anymore, I believe this. And digital healthcare will be really something that will act as the software of healthcare by basically transforming this in a way that the software will become the single, foundational pillar at any healthcare intervention down the road. What we will face is a big disruption, as we have seen in other industries, and we will have to decide collectively, any stakeholder from the past and the present of healthcare, which side of the fence to stay. In conclusion, what's the promise, I believe, of this wealth of innovation? The promise is really to basically hack healthcare in a way that this will be a lot more ubiquitous, affordable, and clearly this has to be sustainable. We all know that healthcare is out of control in many parts of the world, if not everywhere. So this technology, with all the radical changes and with the right deployment in a way that will be ethical and will be human-sized, would probably be worthless if we not achieve this sustainability and this humanization of care, which probably will really be served through these changes. And I think with this, we just ran out of time, so I thank you very much for your attention, for having me here. Thank you.